Good evening. I'm John Bailey. This is People to Be Heard, the program where people who have something to say have their say. Tonight, you have got County Executive George Latimer getting a very important shot. This week, we have been greeted with news of an epidemic of unexplained origin in New Jersey, an epidemic of measles in Rockland County, and it is also very timely to get your flu shot for flu season. And People to Be Heard went to the County Department of Health on Court Street in White Plains, and there George Latimer, shown arriving here, came to get a flu shot, as he does every year, and he had some important things to say. This is the interior of the Department of Health, where people were already lined up getting a flu shot, and in fact, yours truly, John Bailey, your host, did get a flu shot, and it was totally painless. It took only a few seconds. They give you a lot of information about what to watch for, and it's perfectly harmless. But the point would be, there's a lot more going on with the flu than we know about. And at the end of the press conference, I interview Charlita Ambler, the director of the Department of Health for Westchester County, about some of the other issues involving the new, rather scary news from Rockland County and New Jersey. So right now, let's go to that news conference.
Good morning. I'm George Latimer, Westchester County Executive. I'm here with Dr. Charlita Ambler, who is our terrific Commissioner of Public Health for Westchester County. The Westchester County Department of Health, through their nurses, expect to give out 250 flu shots to residents, a total, I think, of 1,700 here, and that includes me. This year, I'm taking the advice that I didn't take a year ago by Dr. Ambler and the CDC's advice, which is to get the flu shot early in the flu season, this being the end of October being an ideal time frame. You may remember last year, like many men, I waited until I was appropriately convinced, nagged into doing it, which I should have done sooner, and I wound up taking it in the first part of this year. But the shot that I get today, I hope, will protect me throughout the flu season, and this is a season that can last all the way into May. This is the right thing to do, and even though I make light of the fact that last year and in other years I've been slow to do it, it is important to be prudent for all of us, for myself and everybody else. So the County Health Department is here to administer these shots for those who can afford it as a convenience, given the physical location here in White Plains. It is also, the nurse team has gone out to soup kitchens, to homeless shelters, and to the Westchester Community College campus and other county work sites to help keep our workforce healthy so that everyone can be served. So obviously, if you haven't had a flu shot yet, join me as soon as you can, and your family members. Don't delay. This is an opportunity to make sure you have good health during the very unpredictable flu season ahead. So I want to ask Dr. Ambler to share some thoughts. Her professional background in these issues, in these areas, has been well defined, and she's been a very strong advocate for preventive medicine, and we're very appreciative. I'm personally appreciative of the influence to make sure I do the right thing.
Thank you. I have to keep you well. So, as you may have heard, the flu shot really is your family's best defense against getting the flu. We give flu shots every single year. It's the only vaccine that you take every single year. So think about how many flu shots have been given over the many years that we've been doing this. So it is the shot, the vaccination that we give the most of. It is the most monitored, and it is an extremely safe vaccine. If you do get the flu, your chances of having a serious complication from the flu are substantially less. Last year, the CDC tells us that more than 80,000 people died of influenza during last year's flu season. Approximately 180 of those were children, healthy kids who unfortunately 80% of those 180 have not been vaccinated. So as you can see, getting your child vaccinated is a very good way of keeping them healthy. This year, I understand that there has been so far in New York State 1 pediatric death, and even 1 death in a child from the flu is 1 too many. Some people can get infected with the flu and have no symptoms, so they can go on to spread it to others. By getting a flu shot, you protect not only yourself, but the most vulnerable people in our population. The elderly, so think of your grandparents. If you know individuals who may have cancer and on chemotherapy, anybody who's immunologically compromised, by getting your flu shot and not getting sick and potentially spreading the disease to them, you help protect them as well. Individuals who are 65 years and older, who have anyone who has asthma, diabetes, heart disease, pregnant women, children under 5 are also at increased risk for the complications of flu. Every year I have people tell me, oh, I don't take my flu shot because I did that once and I got the flu from my flu shot. It is not possible to get flu from the flu shot. It is a killed vaccine, so it's just not possible for that to happen. What can happen is that you could have been exposed to influenza and you could be incubating the virus and get your flu shot. If that's the case, it won't stop you from getting the flu, which is why we want people to take the flu shot early in the season. We don't want you to already be exposed, be developing flu by the time you get around to getting your flu shot. So, like I said, you cannot get the flu from the flu shot. It's just not possible. But it does take a full 2 weeks from the time you get your flu shot to be fully protected against influenza. And during that time, you could be exposed. A recent study showed that, just so that you know, that during the flu season that ended in the 2014 year, there were more than 40,000 deaths during a 9-year period. This is a huge number of people who die every year from something that's absolutely preventable. We can prevent people from dying of influenza, and that's why we do this. So what can you do if you do get the flu? Well, the very first thing is don't go to work. Don't send your children to school. If you've got a fever, if you've got a cough and you're sick, protect the people that you work with. Stay home. Don't send your children to school. Before you get sick, how else can you protect yourself? Wash your hands. Believe it or not, washing your hands is the best thing in public health. It can prevent a whole range of diseases from occurring. And I don't mean just putting your hands in the water and doing this. I mean soap and water and actually rubbing your hands. Sing happy birthday to yourself twice. You'll be in good shape. So what are the symptoms of flu? In case you're wondering, flu symptoms include a fever, cough, sore throat, a runny nose, stuffy nose, body aches, headaches, chills, and fatigue. And if you think you have your flu, then call your doctor, because there are antivirals that you can take. These drugs do work best if they're taken within 2 days, 48 hours of the onset of symptoms. But they are not a substitute for getting your flu shot. So thank you. So I guess we're ready.
I just have a quick question.
Certainly.
I know the county executive alluded to this. You said you expect to give 250 flu shots to residents. Is that
Today. This clinic is open to anyone today.
okay? And you expect to give 250?
That's the number of appointments that we have blocked, that people have registered. We are also taking walk-ins, but that's the number of people who have signed up to come in.
Do you know how many flu shots were given out in Westchester last year?
I have no idea, because we only give out a small portion of them. Pharmacies give them, local doctors give them, so there's a large number of vaccines that are given out every year. We try to vaccinate the people who would have difficulty getting it if we weren't doing it. That's why we're in the soup kitchens. That's why we go to food pantries. We go to shelters to try to get to the people that really don't have access to the vaccines.
There were some complaints last year that the vaccine wasn't that great, wasn't that strong. How would you describe the vaccine this
Well,
year?
when they went back and looked at it, they said the efficacy was about 40%, and on a good year, it's about 60%. So, you know, when we tell you that, you know, it may not prevent you from getting the flu, there are no guarantees in life. But what we can tell you with some degree of certainty is if you get a flu shot, you are much less likely to die from influenza. And I think that's the bottom line.
It's a good incentive.
Yes.
Does the vaccine change every year?
The vaccine is reviewed every single year. There's a committee that looks at what types of flu are circulating in the rest of the world, and then they base that on what they think the three or four most likely circulating flu strains are. So yes.
How does the flu get into America?
Well, people. It's transmitted from person to person. You have any idea how many people fly into this country every day? How many people get on a train, use public transportation? So you're at a bus and somebody is coughing and looks ill beside you, 3 feet, distance yourself, because it's person-to-person transmission.
I have a question. With the measles outbreak, how would you talk to a person that sometimes the symptoms are a little bit alike? What would you advise them?
With measles, the
Yeah.
symptoms are not really, they're much more defined in measles. You get a rash with that, you tend to have a little rash in your mouth, so they're not exactly the same. But honestly, the problem with measles is we don't have herd immunity. This is how vaccinations work. You get enough people vaccinated, it protects everyone. When you have people that are not vaccinated coming into our country who then develop the measles, they expose everyone here who isn't vaccinated. So, that's why when people had their MMR, appropriate number of MMR, they're pretty safe. I mean, the vaccine works well, very well for measles. But measles has a 90% transmission rate. So if you're not vaccinated and you're exposed to somebody who has measles, your chance of getting it is about 90%.
Do school districts require students to be vaccinated by law?
Yes, they do. There are certain exemptions for religious exemptions that exist, but the more people who are vaccinated, the safer they are. People in the past have died from measles. We don't want to see that. We certainly don't want to see that here. And so we have people who come in, not always from other countries. Sometimes they're our own residents who travel abroad and get measles and bring it back. The most important thing you can do for yourself and your family is get vaccinated. The vaccines are safe, and they're much safer than having the disease.
Dr. Ambler, I wonder if you could address the adenovirus that we have just heard about affecting New Jersey. What can you tell us about it?
Well, adenovirus is a respiratory virus, and again, like influenza, it is spread through respiratory secretions. Very important that people wash their hands, that people who are sick, are kept away from those who are not ill. And so I think, unfortunately, there's not a vaccine, and it's supportive care. There is no drug to give. You just have to support the individuals, but primarily it causes respiratory symptoms.
I see. How does this disease progress? Is it possibly fatal?
Yes. It's a respiratory condition.
Yeah.
So if you have individuals who are immunologically compromised, it's much more difficult for their body to fight the virus off.
And there is no idea yet as to how this got into Jersey.
Yeah, I really can't speak to what happened in New Jersey because I wasn't involved in the investigation,
I see.
so I really can't speak to that.
What is the progress on this affliction, as you know it now?
Well, I don't know what they're doing there.
Yeah.
I mean, as I said, right now, unfortunately, there's no vaccine, and there's really no treatment.
And no cases in Westchester.
No,
I see. But no idea how it got into.
I really don't know.
Now, the measles outbreak in Rockland County.
Yes.
Do you have any idea as to how this happened?
Well, I mean, it always happens pretty much the same way, where somebody who wasn't vaccinated was exposed to measles, develops measles, and then exposes other people who are not vaccinated. And so that's exactly why it's so very, very important that people get their vaccine, their measles, mumps, and rubella vaccine, because that vaccine is very effective at preventing measles. And measles is a very, very contagious disease. So if you've not been vaccinated and
I remember it well.
Yeah,
Yes.
if you're not vaccinated and you're exposed, you have about a 90% chance of getting it. It also, the virus stays on objects for hours. So that complicates the issue.
Do we have any kind of a measles problem in Westchester County?
Not at this time.
No.
But, you know, I mean, we always run the risk that somebody, again, who has measles could come in and expose our population, which is why we really, you know, want people to understand the risk and to have their children or themselves, if they've not been vaccinated, get the vaccine.
Yeah. And in the public schools in Westchester do require children to have the measles and various other, what diseases, right? The public schools, at least in Westchester, require
Yes, you are
children to be
required by
vaccinated.
law to be
Yeah.
vaccinated unless you have a religious exemption.
I see. Now, what vaccinations are required to go to school?
Oh, it's a long list.
It is?
It is a very long list.
About how
yeah.
many?
Oh, well, let's see. There's polio, there's diphtheria, tetanus, pertussis, measles, Hib, pneumococcal. There's a pretty long list. It's
Really?
a pretty long
I
list.
didn't realize that.
Yeah.
Okay. Well, thank you very much. So, Dr. Shalita Ambler and George Latimer, County Executive, you have been heard. And for an update on this adenovirus that Dr. Ambler was talking about, 9 children have died as a result of adenovirus at the Wenatchee Center for Nursing and Rehabilitation in Haskell, New Jersey this week. The Wenatchee facility has been instructed not to admit any new patients until the outbreak ends, and they're in full compliance according to the New Jersey Health Department. This is from CNN reporting. The timing of the deaths is not clear. The health department is notified of respiratory illnesses at the center on October 9th, and Wenatchee sent parents of children at the facility letters about the infection on October 19th, according to the New Jersey Department of Health. The New Jersey Department of Health said it's an ongoing outbreak investigation, and workers were at the facility Tuesday. A team at the facility on Sunday found minor hand washing deficiencies that going right to the heart of what Dr. Ambler said about washing hands. The department continues to work very closely with the facility to ensure that all infection control measures are being followed, though the Wenatchee facility said in a statement Wednesday. Now, the exact ages of the children haven't been released. It's under the age of 18, mostly, but most of them were health compromised to begin with. Now, adenoviruses can cause mild to severe illness, according to CNN, and serious illness is less common. People with weakened immune systems or existing respiratory or cardiac disease are at higher risk of developing severe illness from an adenovirus infection, according to the Centers for Disease Control and Prevention. This outbreak is affecting medically fragile children with severely compromised immune systems. The strain has been particularly associated with disease in communal living arrangements and can be more severe, according to the health department's statement. In a statement Tuesday, the Wenatchee facility said it promptly notified all appropriate government agencies when the virus was initially identified. Now, the Wenatchee Center was awarded an above-average ranking in overall quality, but was given a below-average health inspection rating based on inspection conducted in August. And it was determined that the facility failed to provide a clean and home-like physical environments for their residents. Now, Adenoviruses infections are mild, with symptoms usually lasting about 10 days, according to the Center for Disease Control. And for most patients, home remedies and over-the-counter medicines to relieve the symptoms will be the only treatment necessary. Adenoviruses, unlike the flu, are not seasonal and can cause illness throughout the year. And while an adenovirus vaccine exists, it's only available to military recruits. The viruses themselves are also, according to CNN, resistant to many common disinfectants and can remain infectious for long periods on environmental surfaces and medical instruments, the Center for Disease Control says. Adenoviruses tend to be spread by coughing and sneezing, direct contact with an infected person, or touching objects and surfaces, such as door handles and light switches. So, in retrospect, washing hands frequently is a way to avoid adenoviruses, and if you are in compromised health, it is even more important to practice cleanly habits. Adenoviruses can stay stable at room temperature weeks on unclean surfaces, according to a director of clinical virology and molecular microbiology at Johns Hopkins University School of Medicine. So basically, what Dr. Ambler says, washing hands, very important, do it frequently, and the adenoviruses, though rather sensational, in fact it has killed 9 persons under the age of 18 at the Wenatchee facility, is not anything new here, and we just have to be vigilant about it and wash our hands. Well, we want to thank Dr. Ambler for that brief interview, and also thank George Latimer for focusing attention on the need to get a flu shot. Now is the time, because it takes 2 weeks for the shot to get effective, as Dr. Ambler mentioned in her news conference remarks. But, and this is important, they're not nearly as serious as influenza, so get those flu shots. George Latimer, County Executive, and Dr. Charlita Ambler, of the head of the Westchester County Department of Health, you have been heard on the flu. We hope that this information has been helpful to those of you who have not gotten your flu shot. And once again, I have to say, I had it at the county facility, and it is just, it's a piece of cake, as the county executive said, and it will save you a lot of misery if you from getting the flu. So, this is John Bailey saying, hope this program has been helpful to you, and good night for people to be hurt.